the reason insurance was created, for unforeseen, unbudgetable big items. It wasn't made to go see the doctor for your physical. So they merged healthcare and insurance, and we got health insurance then instead of major medical. We got them together, and that's when the thing went off the rails.
All right, welcome everyone to the inaugural episode of the Healthy Savings Podcast. We're excited to be kicking this off. My name is Sasha Gribov. I'll be your host. I'm the co-founder of a company called Mule Health, and we're joined on our first episode by Carl Schuessler Jr., who's the managing partner of Mitigate Partners, as well as an advisor and many other things. Carl, how are you? It's exciting to have you here.
I'm doing good, Sasha. It's a little chilly down south here. So this is going to be about 16 degrees tonight. So
I'm in Chicago, and I think it's about -8 right now. And the pictures from our lake have the air kind of coming up over it, which is wild and looks like the apocalypse.
Right.
Well, I figured we would start by talking about college football. Do you think that's a good way to go, or should we avoid it for a little bit?
Well, I'm a good sport. I'm a fair sport, so I think it's just fine. So.
Now, just for everyone in the audience, Carl is the biggest Georgia Bulldog fan that I know. Now, admittedly, I haven't met that many Georgia Bulldog fans. I know it's an amazing fan base, but I think Carl is top of the line. And I'm a Michigan fan, so we've been talking about college football all year.
Yeah,
but,
too bad they didn't get to play each other. Right? Georgia was favored over both teams in the national championship game if they had played head-to-head. So I wish we would have had an opportunity to see it. But you guys did shine out and arguably were the best team. Certainly, I didn't expect Washington to give y'all much of a game because of the line of scrimmage. That's the difference with that Pac-12 league. No offense to anyone out there listening, but it's just not a line of scrimmage league. Just not.
So before we move off the topic of sports, I'm here in Chicago, and you've got a Michael Jordan poster behind you. So I'm wondering if you got any story about that one.
No, if you look up, that's a real young picture of me. Long time ago, that was probably 95, 96. When I started my career at Northwestern Mutual, there was a most improved award the best year over your last year. And I'd won that award, and with it came your placement of an ad in any magazine you wanted. So in the South region, probably predominantly Atlanta area, that Michael Jordan issue where he announced he's retiring was where that ad was placed. And honestly, when we moved, I was debating putting it up, but I'm surprised you could see it. Most people ask about the fish.
The fish is cool too, but I grew up dribbling a basketball in my basement. It was one of those basements with the wood paneled floors all over, and I had a big Jordan soaring through the air poster down there. So anytime I see a Jordan picture, I gotta ask about it. That's awesome.
Long time ago.
Yeah. Let's talk healthcare. So the idea behind Healthy Savings is to find leading advisors and leading benefits leaders throughout the industry and pick your brain on what you've seen in your career, what's changed, what hasn't changed. It feels like kind of healthcare goes in these cycles where the new thing is kind of the old thing from a decade ago. But it also feels like things get better and a lot of other things don't. And the folks who I think can give the best insight on it are the ones who are on the front line. Sometimes that's physicians, sometimes that's nurses, sometimes that's employers, sometimes it's benefits advisors who are working with a ton of employers. So I'm really excited to get your perspective. Maybe just to orient us, could you tell me about how you got into this world?
Sure. September 26, 1967. I was born in Augusta, Georgia. My dad was in medical school, all joking aside, but he was in medical school there. He was a private practice OBGYN for 49 years in Macon, Georgia. I know you thought I was from way up north, but I'm really not. I was exposed to healthcare, when I was younger. I knew a lot of doctors throughout the community. Macon had the highest, percentage per capita physicians south of Atlanta. And so I was around doctors because of who my dad was, and worked at the country club and the golf bag room and put bags on carts. So I knew tons and tons of doctors. And, back then, the reason I bring this up, I even played golf with a former HCA hospital administrator back in the day when my dad was practicing. And things were just very different then, Sasha. I mean, and again, I was young, really didn't know a whole heck of a lot. As I got older, I could kind of see things. And I tell the story often of I went to get a physical before I went to the Harvard of the South, no disrespect to the University of Georgia. But before I went to school, I had to have a physical like you do. And I went in Dr. May's office that was in an antebellum home in Macon, beautiful, big columns, just gorgeous house. And in his office, he had black and white tile floors and so forth. And I'll never forget, it was August of 1985, and I went in there. Walked in, and Miss Yancey was there, and she was a little fireball of a woman, as I say. And I just remember what was going to happen, and I hated it. And see, Sasha, you're too young to remember this. Back in the day, they got a razor blade and pricked your finger, and then you had a gauze on it for like 8 hours after to where it wouldn't bleed. And I knew that was coming. So it was August 1985, Macon's hottest fire, I promise you, one of the hottest places on earth. And I'm sitting there sweating profusely, and I'm waiting on Miss Yancey, and she grabs my thing and, does that and all and so forth. And, I had my appointment. But as I looked around the room that day, how many people do you think were sitting in that room with me in August of 1985?
I'm guessing 2 or 3.
Yeah, how about 0? Because that visit at that point in time was a healthcare visit. There's no health insurance involved with that. It was my parents paid the doctor to see me and do my physical. And that was it. There was no insurance involvement. The office had hardly anybody. They had maybe 2 or 3 employees. And this Dr. Mays had a big, robust pediatric practice. Okay. Now, the reason I bring that up, and I want to get perspective. So these things came to roost later. I mean, I was still a young guy. I wasn't paying much attention, but I remember there was another situation that happened. There's a doctor named Dr. Golf. Okay. We called him Dr. Golf. We played golf all the time. And he was an OBGYN, solo practice OB. My dad was, with 3 partners, 4 counting him. So my dad, when he started with Dr. King out of the gate, it was him and Dr. King, and he's on call every other night. I mean, every other night, Christmases, whatever, he wasn't there. So as he grew the practice, then he was on call every 4th night, right? I said, Dad, Dr. Golf is out here all the time at the golf course. Why are you never out here? You got 3 other partners. I just don't get it. And this guy's on call all the time, but he's playing golf all the time. And he said, son, his C-section rate, 60%, mine's 15. And again, that meant nothing to me then. But as I got to where I am now, and that's why you asked the question, I reflect on that often because my dad did it right. He didn't go and cut unless it was necessary. And his C-section rate was way below, the national average. I think at that time it may have been 18 to 20. Those are important things to know. So when Sasha want to know when his wife goes to see Dr. Schuessler that she's going to get cut open 60% of the time when it is not necessary. So those are the little nuances no one really knew. Only the other doctors in town knew that, but you and I couldn't get that information. Now, of course, we can in our fair cost health plan, as you know. But the point I'm making is I go back and I look about the late 80s, early 90s. I'll never forget my dad came down and I was just getting ready to graduate. And he came home. He said, son, it's over. I said, what, Dad? And he said, healthcare. It's done, over. Because he decided, Sasha, back in the day, that he wasn't going to participate in networks. He was not going to do that at all, that he had built a reputation and people come to him because they want him because he's a good doctor. So Dad opted out, and here's what happened. Somebody came in to see him, and this patient had come to her for 20 plus years. And she said, Dr. Schuessler, I'm not going to be able to come here anymore. And he goes, oh my gosh, did we do something wrong? And she said, no, you're not in my network with my new health plan. And, I can see the doctor for, $5 copay. But if I come here, I got to pay, I don't know, 80, $100, whatever it was then. And you're not my network. And that's when Dad came home and made that comment. So he eventually had to get into networks because all of a sudden now managed care, all these executives came and ruined healthcare. They came in and they masked the cost of a real visit. Ain't no visit for $5. I mean, how about going to a Mercedes dealership, buying a Mercedes for $5 copay? I mean, that don't happen. I mean, you pay full price, right? So what I think was interesting is in the late 80s and early 90s, healthcare and insurance was major medical, Sasha. So it only came in unless you went to the hospital for catastrophic claims. The reason insurance was created for unforeseen, unbudgetable big items. It wasn't made to go see the doctor for your physical. So they merged healthcare and insurance, and we got health insurance then instead of major medical. We got them together, and that's when the thing went off the rails. And the care, the hospitals at HCA, administrator, great person, and we work with HCA with some clients, great person, but it all became about the money. It's never about the care. The patient is on the periphery as a profit center for the insurance companies, not all the physicians, hospitals, pharmacy benefit managers, PBMs, program billing millions, as we call them. All of these folks, the patient's on the periphery, and we got to get the patient back in the center like it was back when I was a kid. And that's what we really try to do. That's a lot, and I'm out of breath.
That's amazing. I have probably 10 different questions for you, but you brought to mind two things for me in my own life. The first is my grandpa, who I was named after. He was actually a surgeon, a general surgeon in the former Soviet Union. So, you can imagine he was operating in the Ukraine in a city called Dnipropetrovsk. Now it's called Dnipro. But he was like the top surgeon in town. And, there the healthcare system was terrible and terrible conditions, and doctors didn't get paid, and patients weren't safe and all that. But he went home every day very happy that he was taking care of his patients, and he had a real relationship with his head nurse and with his patients, and his patients knew him. And the way that you were talking about your patients knowing your dad was the way I grew up hearing my grandpa talk about the people that he operated on. And when I talk to friends of mine who are surgeons today, some definitely feel that way. Others feel like they're burdened with administrative stuff and prior auths for half their life, and it really takes away from what they do. And then the other thing that brought to mind was when I was a kid, I remember I had a pediatrician who I loved, and then one day my mom was like, "Hey, we got to switch pediatricians. Your pediatrician retired," and he was young. He was, I don't know, mid-50s. And I didn't get it. But I figured it out afterwards that, the healthcare system changed around him, and he wasn't doing what he was called to do anymore. So,
Josh, you know what's interesting is we're trying to go back to where it was. Everything always seems to circle back, doesn't it?
Yeah.
And my dad, I'll tell you this, and the doctors in general, but they went out to take care of people. And that's what they wanted to do. So when it came time to lobby and do things like that to protect themselves, groups like the AMA and all these groups just let them down. They didn't do anything at that point to fight for themselves because they were taking care of patients. They didn't get out and fight, and the world got taken from them. But again, that's not what they were trained to do.
So how did you come to a place where you've gone and created the Fair Cost Health Plan, or a health plan where you see you actually being able to change how this massive behemoth of a system exists, and then here you are creating something brand new that goes against it? Like, what gave you the idea for it, and how'd you do it?
Well, a big part was because it wasn't. I really had no ever intention or design to do that, but as we kind of found it and got Mitigate Partners going, I knew it was probably 2015. It was really 2013, I guess, technically, when I got jacked up in the face with a baseball at coaching my son's middle school baseball team. And it's a long story. Thankfully, this beautiful face I have today, I didn't have to have any surgeries. But if it had been my son, it would have taken multiple surgeries because the bones would have been broken and everywhere. I mean, I had a face a little like a Jerry Garcia tie-dye T-shirt for about 3 weeks. I went into the ER and all that. And about that time in February of 13, the Time Magazine article is the longest article in the history of Time Magazine, was by Stephen Brill. It's called The Bitter Pill. I'm sure you've heard of it. And, I was looking at it and I was reading it and I'm going, golly, I sure thought something was wrong. I mean, how the heck does this stuff keep going up in cost? What's going on? And it's the price of care that's the problem. That's the problem nobody addresses. But anyway, when you read all that and you see a bag of saline they buy for 20 cents, they charge, $100 for, those are the kind of things that kind of caught my eye. And I chose a different path, and I started talking with third party administrators, TPAs, and trying to build our own plan. I knew that we couldn't do what we wanted to working with the cartel, as I often refer to the insurance companies, because they have misaligned incentives and everything else. And so I went to TPAs and started talking to them, and I basically make a call like this: "Hey, Sasha, this is Carl Schuessler. Gotham told me I ought to meet you. This is what I'm trying to do. Basically, I'm having a party, and I've got the band locked down. I got the catering locked down. I got the booze locked down. I'm ready to roll. I just don't have a venue. I need someone to host my party. Will you host it? Well, you can't serve, Creature Comforts is a beer out of Athens, Tropicali. You can't serve Creature Comforts. You got to serve Bud Light." And no, I don't want to serve Bud Light. Well, you have to. So basically what I'm saying is the TPAs had their ways, and they didn't want to. I wanted to bring my party to them that I built and have them administer it. And the only money they received was the process, the claims, the admin fee they would get for processing claims, which is what a TPA was supposed to do. But TPAs had aligned themselves with other solution partners and things, and they were making money on some of the solutions they put in to people's plans. And I was trying to remove that, which I did. And so our TPAs only got paid what they deserved, which was the admin fee. And I say it often, all TPAs suck is finding the least sucky of the suckiest. And that's still a challenge and a never-ending journey. We work with some decent ones, but at the end of the day, it's amazing how rudimentary and how outdated systems are and things in healthcare, Sasha. So when you pull the veil back, people had no idea the system worked. It was unbelievable what they could see and struggles and so forth. So that's what we did. And we built a program that enables members to get the care they need to get, and generally with very few barriers to care, and a nurse navigation guided with all kinds, as we refer to it, as a house. Each brick represents a cost containment solution, and we generally have a quarterback with DPC, direct primary care, as the foundation. And that's really what did. It wasn't by design. I wasn't trying to create. I mean, it's just I couldn't do what we wanted to do for the clients in the system we were in. And it's still way far from perfect, but it works pretty well. And I think the care that people get, the clinical outcomes are definitely better. And they're identifying better doctors, with the help of our team. And all of our team communicates together on a HIPAA compliant board we created, where they all work for the betterment of the member. And it's really pretty cool. And really the way healthcare was meant to be.
When you guys rolled it out for the first time, I think you were saying with the school district, how much did you end up saving? Like for a typical employer out there who's hearing this for the first time and thinking, okay, great, like maybe I'll do something different. What's the opportunity? Like how much impact can you have in the bottom line?
First year I think it was $6 million, but that's because Cigna was still in the driver's seat. But really, since then, I think the numbers, and I'd have to ask Barry, I think they're in 4 years are approaching, I think they're between 50 to 60 million is what they've saved, which is quite amazing. And
that's wild. That's a lot of teachers and books that you can hire and buy.
A lot of extra programs you can put in that you don't have the budget for. So yeah, it was pretty big. And I mean, that's 6,500 lives, 9,100 belly buttons. And that's what's possible. So it's quite substantial. 30, I think it's 30-something% overall, somewhere in that range. But yeah, that they can get the care they need, and got a great PBM partner, got a good pharmacy consultant that we work with, Chuck Gamsu. He's awesome. We built it from the ground up and worked with community pharmacists that we brought a great fella, Eric Larson, down there that ends up eventually putting a pharmacy in the health center as well. And he's been an unbelievable partner. And we've got a really good local care team, pharmacist, hospital, physician. And I think the pharmacist is integral. Today, they're struggling to pay the bills, and they really can't be part of the care team because they're not in line for it. But in this model here, we were able to integrate, we call it integrated coordinated care, IC squared, really put it together. So
That's awesome. What is it? What does it look like for the patient if they have to get involved with the healthcare system and they're on one of your plans? How do they see it?
Good question. I think that you'll get a lot more mileage, Sasha, with a stick, and I'm going to give you what the carrot is in a minute. But if anybody's having a pre-certed or elective type surgery, then they're required generally, and not in all the plans, not in all of them, but some of them. I mean, I think it should be this way in all of them. It's up to the employer, but we know what works. And if they make the phone call, if they don't call, then they're penalized $1,000, and that's just $1,000 less the health plan reimburses. And if they make the call, they still can listen to the navigator, and the navigator says, you shouldn't see Dr. Schuessler. He talks kind of funny. You need to see this Sasha guy. He's a lot clearer communicator. And they still want to go see Dr. Schuessler, then the plan benefits will pay like they've always paid. But if they go see Sasha, then maybe they have no out-of-pocket costs, no deductible, etc. So the steerage patterns, by doing things like that, they still ultimately have the choice. The choice is never taken from them. But if they choose the better paths for care, then they'll be rewarded likewise. So,
you know what's wild though? You called it a stick, but it's a carrot and a stick, right? It's one thing if you go in and you introduce a stick and it scares people and it's effective, but it's just a stick. But you're talking about zero copay, zero deductible. That's crazy for patients. In our world right now, one of the things we do is we help people fight bills. We just had one come across $19,000. It's wild, right? But if there's an option where someone could have a big zero, and it's their choice, that's revolutionary.
Now, it makes a big difference, and I think in the system that we're in, I mean, it is so hard. I mean, how do you know? I mean, when you can buy a car, you can go research J.D. Power, Kelly's Blue Book. You got so many places you can look. You can't find anything out about hospitals or doctors or any of that. It's just all hidden from you. And then, but quality transparency is equally important. And those are the parts that are hard. If you're a doctor like my dad, he knows who the best people in town are because he practiced. But I will tell you, even being removed since January 15, he don't know who all the best are anymore because a lot of his group is gone. And, so it's really difficult. The system is so convoluted. And my dad had a partial knee in September of 22 and then had to go back in December and had a plate. He broke his tibia and had to have a plate put in, then had airborne bacteria and all this, had to open up a couple more times. It was a friggin' nightmare. And I tell you, if you don't have an advocate there for you, or you hire somebody, or you figure it out and you try to learn yourself, you're in trouble.
That's crazy because you say that as someone who's deep inside the system. Like you understand, and your dad was a part of the system, right, for so long, and you still needed that. I've seen that with my own family, that if someone's in the hospital and you're not there and you're not advocating, it's really rough.
Yeah, you have to have that. And many people said, hey, Carl, y'all need to start, Mitigate Partners needs to start a business or do something like that. I mean, that's not easy.
Yeah.
But yeah, that's a whole business that I think someone could have because and really fulfill a major need.
Well, we're coming up on time. I got one last question I want to ask you. You've been in this space for a while. You've created something brand new that at least I think is revolutionary. You've been around healthcare your whole life. Where do you think this thing is going? Are we going to continue to be in a world where more hospitals and practices get bought up and insurance companies get bigger? Do you see independent plans starting to make some headway? And if you could make a wave a magic wand, what would you do?
Golly, whoo! That's
I figured I'd leave you with an easy one.
Yeah, and you know me, I'll take 4 hours. From what I've gathered, when you look across the country, the trends are 70% of the doctors are owned by hospitals, 30% are independent. And that independent number seems to be shrinking, right? You never meet many doctors that agree to have a hospital buy their practice that end up being happy in that environment. At the end of the day, that most doctors are control freaks, and I don't mean that as a negative. I mean as a positive. all of a sudden they're being told what to do because, this is more profitable than this and that, and so forth. So, Sasha, from what I'm hearing, there are a lot of hot doctors that are very unhappy in these hospital settings. So some of these hospital doctors could be leaving. I've heard this, I mean, from different people I respect. So I don't know. I don't know if you'll see I didn't think, over all the years you see roll-ups and then they'd unroll, roll-ups, they'd unroll, acquired, and then we don't like it, let's get back out when that period of time's over. I didn't think you'd ever see another unroll, an unroll, as I call it. I don't know, but that's what I'm hearing. And there's a big wave of people, trying to get into the medical schools to have direct primary care be really talked about and discussed. There are great groups like the Benjamin Rush Institute, who is doing scholarships and making people aware of these things. And I think if we can get more of these doctors in more of a direct primary care relationship, I think we can turn around. But we have a shortage of doctors everywhere. That's a problem too. And if my kid was going into medicine right now, I wouldn't encourage them to be a doctor. In this environment, unless they were going to be a direct primary care type physician and have direct relationships with their patients, But you're seeing direct specialty care come out. I think that's a tough, again, I don't have all the answers. How do you make that work? Well, not everybody needs specialty care. So how do you do that? Primary care is different. So I think that's one of the things. I don't know if everybody thinks we're going to get a single payer. I would assume at some point, probably, I don't know. And I do think you're seeing more and more employers who now, again, are we at a tipping point? Everybody's been saying this for years. Are we at a tipping point? We're at a tipping point. We're at a tipping point. Well, it's still difficult to get an employer to do what we're talking about doing, to do what we call an employer-built health plan instead of an insurer-built health plan. It's not easy, even though we have unbelievable numbers of success stories and people that will get on the phone or get on a meeting and talk to people about this and how great it's been for them. It's still not easy because you've got a lot to overcome. And I believe as this healthcare continues to sit 2 or 3 on everybody's P&L, health insurance that is, then they got to do something. But why aren't more of them doing it, Sasha?
It's a good question. All right. Well, Carl, thank you very much. It's been wonderful talking to you, and we're excited to keep this going.
Yeah, I appreciate the opportunity to be on here, and love what you guys are doing at Milu, and look forward to the 2024, and should be great.
Thanks for listening to Healthy Savings by Milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.